Welcome to the University of Queensland Medical School Ochsner Health Crossing Borders webinar. We are preparing for medical school abroad. Today is our topic. And I'm Melanie. I will be the host. My title is Enrollment and Admissions Specialist. Today I'm joined by Pete Carseldine. He will be manning the chat. So if you have any questions during the chat, please just pop them on in. We are joined by Sue Barros, Director of Admissions and Enrollment here. We have Aachal Gunda. She is a current second-year student. We have Flohr joining us from our UQ team. And then we have Stacey Bigg, who will be our main presenter and panelist today while we go over our work integrated learning slides. As you can see, this is the location of the University of Queensland and Ochsner Health. And then these are our panelists that are going to be joining us today. All right, Stacey, take it away.
Thank you for the introduction, and hello everybody. I'm really pleased to be here with you today and to discuss key compliance requirements for the Doctor of Medicine program and share important information about immunisations and offer some practical tips to help you stay on track to avoid, common oversights that occur. So prior to starting the Doctor of Medicine program and its associated placements, it's important to fulfil certain compliance or pre-placement prerequisites. These prerequisites are referred to as work integrated or WIL requirements. So all WIL requirements must be completed by the deadline listed on our website, and we'll highlight key dates and details throughout this presentation. So you'll notice that some requirements do have expiry dates, and this will mean you'll need to renew them at certain points throughout the program. So it's really important that you know it's your responsibility to ensure that all requirements remain current. So staying on top of these is, again, very important. Our website, which is hyperlinked throughout the following slides and presentation, will provide clear step-by-step instructions for each requirement. And we strongly recommend referring to it each time you complete or renew a task. This way you can make sure you're following up-to-date or our most up-to-date processes and using relevant providers to complete your tasks. So on some of our next slides, we have a handy acronym key in this presentation. So if you come across any abbreviations throughout the presentation or requirements you're unsure of, you can circle back to this and have a look for some extra guidance on these abbreviations and things. I won't go through them. There's a lot there. You can peruse at your own leisure. If we can go to the next slide, please. We have here our top tips to becoming compliant. So we recommend throughout your whole program, you checking your student email very regularly. Our team will be sending important updates and reminders about outstanding requirements as we approach the compliance submission deadlines. So really important to keep an eye on your spam or junk email folders. Sometimes communications will flow through there. And it's also a great idea to consider forwarding your student email to a personal account that you check frequently. This way you'll never miss a message. We recommend monitoring in place after submitting your compliance documents. So in place is the system where you'll upload most of your WIL compliance documents. You're able to access this system only once you've enrolled. And then after submitting your documents, really important to check back and just make sure your documents have been accepted by the university, and this will show as they're being verified. So you want to look for a green box that says verified next to your items you've submitted. Documents can actually be rejected if something's not filled in correctly or there's some missing information. So this will look red and it'll say the word rejected. So just again, important to not assume that everything is approved just because you've submitted it. You just need to check back and make sure it's been accepted and has green verified written next to it. With your immunisation records, we'll be providing a more in-depth look at that as we go through the following slides. But for now, the key message that I want to highlight is that it is recommended you get started on your immunisation documents as soon as possible. This process can take several months to complete, as it often involves multiple visits to your doctor, depending on your previous vaccination history, medical background, and any travel you may have done. So while overseas, the best step you can take is to visit your local medical practitioner before you leave home. And this will make things much easier for you, as you can update your immunisation records, complete any outstanding vaccinations or screening tests, and you can just collect all the necessary documents while you're in your home country. And great idea just to ask your doctor for a written or stamped record of your vaccination and any blood test results, and just make sure these are in English. You will receive an email on January 5 with instructions on how to submit immunisation evidence as well once you're starting the program and enrolled. And the final tip here is just making sure you upload your documents correctly. So we just recommend always updating the full document as a single file in InPlace or MyQ, another system you'll use to hand in some requirements. So even if it looks like only one page is important and has the information we need, just hand in everything. This will just help your submission be looked over, completed, and processed without delays. Next slide, please. So here we can discuss in more depth information about immunisation. So basically, there's two forms that every student must complete. The first is the Student Immunisation Record Form, also known as Form B, and this lists all the required vaccinations. Your vaccination date should be added to the form by a medical practitioner who should also complete and sign this form. And again, you can find the form and the vaccination details on our website. The second form that needs to be completed is the tuberculosis or TB self-assessment form, which you can complete yourself. So again, for students starting in 2026, our team will be raising an immunisation evidence request. This is usually received by everyone as an email. And once you have that, that's where the link will be to start uploading your immunisation and TB or tuberculosis evidence. So some parts of this process, as we discussed before, can take time. For example, if you've never had the hepatitis B vaccination before, completing the full course can take between 6 and 12 months. And if latent tuberculosis testing is required based on your travel or location history, that can take up to 4 months. And while I have everyone, I wanted to highlight at this moment varicella vaccination. That's one of the requirements, or it's also known as chickenpox vaccination. It's one of the required vaccines that we need, but there have been some supply issues here in Australia. So if you can get this vaccination in your home country before arriving, we strongly recommend it. If you can't or you face any delays, do just reach out to our team closer to enrolment time for some advice. Other ways you can achieve compliance is by providing a blood test, which is also known as serology, confirming your immunity. And for the chickenpox, you can provide documented history of physician-diagnosed chickenpox or shingles. So in a quick summary, before you arrive in Australia, we recommend seeing a medical practitioner, gather all your forms for immunisation and screening records, bring them to your doctor, have them complete the form. And then after you arrive, and once you've submitted your documents, the UQ immunisation team will review your documents against UQ and Queensland Health standards. They'll give you personalised feedback and timelines, that actions you need to complete to help you meet compliance. So if you know you have outstanding requirements, or if the team advises you that more information is needed, you could, or you should, book an appointment with a local medical practitioner or UQ Healthcare service and complete any vaccinations and finalise your form. Really important to just follow the timelines set by the immunisation team. This will give you the best chance to stay in compliance throughout your first year. And as always, once you've submitted some documents to us, just don't take for granted that it's finished and accepted. You just need to keep an eye on your case and make sure you're seeing the word completed. That will show you've met your requirements. Deadlines for this requirement are around 27th of February 2026. And you should submit your immunisation forms even if they're not finished at this time. So partial forms, we need those submitted. Next slide, please. Criminal history. So there are 3 different checks that you'll need to complete for the Doctor of Medicine program. The first is a National Police Certificate, and the easiest way to complete this is to do this through the Australian Federal Police website, which again, we link you to via our website. The second is a pre-check. This is essentially a student background screening check. And the third is an FBI records check. The ideal time to start these checks is around the end of October and into early November, as they can take some time to process, and in some cases up to 3 months. So please just make sure you review our website carefully for the step-by-step instructions, as well as important exclusions. So for example, when obtaining an FBI records check, we cannot accept checks that are processed through approved channelers. It just needs to be done via the official website and processes. And for example, the National Police Certificate, we cannot accept checks that are issued by Queensland Police. It's preferred that it's the Australian Federal website. Police website. So our website, again, will link you into the recommended sites where you can obtain each of these checks. And just a reminder, again, the deadline for these is the 27th of February, 2026. Next slide, please. So for first aid and CPR requirements, these are something you're able to get started on ahead of time if you wish. Certificates that are obtained internationally from recognised organisations are acceptable, provided they just meet the criteria and assessment requirements of a particular course here in Australia called the HLTAID 011 Provider First Aid course. We just recommend, again, reviewing the website to make sure your course that you select overseas is a match for the topics that we need covered. And this will just help you avoid disappointment and any other additional costs. And one important thing to note is that we do not accept online only courses. So you must complete a course that is either like a fully in-person or a blended mode, meaning there's an online theory course and then an in-person assessment component. Important to know here in Australia, first aid certificates are valid for 3 years, while CPR should be renewed every year of your program, and our team will send reminders. And just here on the slide, you'll be able to see some examples of accepted providers that we can accept. So before we move on, I just wanted to take a quick moment and check in if there are any questions that we can help answer at this stage.
So far, I don't have any questions in the chat. So if you guys do have questions, please just remember, put them in the chat, and we'll either try and answer them through the chat or at the end, or cute little breaks like this. All right, back to you, Stacey.
Thanks, Melanie. Okay, so next slide, please. Okay, so throughout the Doctor of Medicine program, you'll undertake placements across a variety of Queensland Health settings. So to be eligible for these placements, there's a few important Queensland Health pre-placement compliance steps that you need to complete. So first up, I wanted to talk about the orientation checklist. So you'll need to upload from this document the first 3 pages of the latest version. So Queensland Health often update this template, so just making sure you've got the latest version. When filling out this form, it's important to just make sure you've literally got every box ticked. It's just very particular standards on how this form must be completed. And you need to make sure that you have all of the check dates and the expiry dates for your legal checks completed on the form. So one thing that's often missed is the expiry date is not included on the orientation. The expiry date for the National Police check is not included. So it's a great tip to know that this is usually 3 years from the date of the check. So just making sure that's on the orientation checklist. Other areas that are often missed include leaving out immunisation dates on the form or not having the document signed or even dated. So just little things, but if you can just double check that, make sure it's all completed correctly, it has a greater chance of being accepted the first time. If your submission isn't completed to the Queensland Health Standards, as I said, our team will reject this in place, so you'll get the red rejected mark. We will leave you some instructions on how to fix it, so we'll itemise the steps you need to do to correct it. So please just, again, keep an eye on that, verification in place, and you'll know it's accepted when it says verified. Next up there, we have the student deed poll. So this is more relevant as you approach year 2 of the program. It's a legal document that outlines your responsibilities during placement. So you'll need to access the downloadable form via our website, select the relevant hospital and health service from your placement, and then have this witnessed and signed. And you need to submit a new deed poll for every placement you do, even if you've done one before. So great tip, this doesn't need to be uploaded to InPlace. You'll be provided with instructions closer to the time on who to give this to. So next slide, please. So on this one here, I'd like to discuss a little bit about iLearn modules. So prior to submitting the orientation checklist, which we discussed on the previous slide, you need to complete some mandatory online courses. So these courses are designed to help you understand the environment you'll be conducting your placements in. They'll help guide you on your interactions with staff and interactions with patients and make sure you know how to keep yourself safe. So to get started on these, you need to first register for iLearn, again, following the step-by-step instructions noted on our website. Some technical help and support has been listed here on our presentation as well if you get a little bit stuck. But once you're registered, you'll be required to complete the following modules, which are over here on the right-hand side of the slide: keeping you safe, working ethically, first response evacuation instructions, and the Safe Child Protection Training module. When you finish this, we need to cite evidence that you've completed these. And so you'll be able to download a transcript from the iLearn site and you'll upload that into InPlace. Next slide, please. Thank you. So next up, we have national hand hygiene initiatives. So hand hygiene is one of the most fundamental parts of patient care, prevents the spread of infections and helps protect both patients and the healthcare environment from contamination. So as part of your requirements, you'll need to register for the National Hand Hygiene Initiative training. So instructions on how to register, again, are available on our website with step-by-step and images to assist. Once you've registered, you'll need to complete the two modules here: the hand hygiene for clinical healthcare workers and the basics of infection prevention and control. When you finish these, again, we need to cite the evidence that they have been completed. So you'll need to download both the certificates and just combine them into one document for submission into InPlace. And then again, for more information about this and for direct access into the NHHI modules, you can visit our website. It's Prepare for Your Medicine Placement website. And it's just a reminder, once more, the deadline for these is the 27th of February, 2026. Next slide, please. Okay, so on this one, we're talking about the Disability Worker Screening Check and Blue Card. So the Blue Card is Queensland's Working with Children check, and the Disability Worker Screening Check is required for students who may be placed in settings where they have contact with people with disability supported by the NDIS. Because placements throughout the Doctor of Medicine program can involve working with both children and people with disability, you're required to have both clearances. So you can make a combined application. This is the easiest way, 2 for 1, combined application via the Disability Worker Screening Service. So you don't do it through the Blue Card service, it's done through the Disability Worker webpage. And the combined card will be valid for a period of 5 years. Once you've applied, you'll receive an online Blue Card account number, and this needs to be uploaded to InPlace. And there's a few important tips that we've come to learn that we can highlight with you. So first, you can absolutely wait until you're here in Australia before applying for these cards, as it is easier and more time effective to apply in person. The first step of the process is to obtain what's known as a customer reference number, or CRN. And you get this from visiting a Queensland Transport and Motor and Roads, or TMR, service directly. So you need to take in some evidence of identity with you into the TMR service. Again, our website will link you into acceptable forms of identity you can take with you, but I thought I'd highlight some popular and simple options our students typically use. So they'll often take along a student ID card that it has to have a photo, or passport. And if you actually have 2 bank cards from 2 different providers or institutions, these can also count as 2 separate pieces of identification. So on our next slide, we do have this step-by-step instructions. Again, these are also outlined on our website to just walk you through the process. So as before, the first step is to obtain your CRN. And then you want to be basically registering for an online account with the Disability Worker Screener website. And then once you have that account, you're wanting to be logging into the worker screening portal, submitting a combined application. Through that process, that's when they'll give you the Blue Card account number. Do keep in mind, this will be different from the Disability Worker Screening application ID. So our team, we want the Blue Card account number. And once you've got that, you can put that in place, and that's when we'll link you to our organisation. And then the requirement will be complete. So again, as before with all the other requirements, monitoring your InPlace account and making sure everything is green and accepted and verified will show that your requirements are completed. Anything else, you'll just need to keep looking and keep actioning items as needed. So that's all about the requirements. I believe our next page, our next slide, just has our best contact information. So here you'll be able to see that you can get in touch with the Ochsner enrolment team where needed, or our team if you have compliance questions or need assistance. You can have a look there. We also have an online chat feature as well. So at certain times of the day, you can talk with us in person via our chat system. But that's me. Thank you so much. I'll hand back to you, Melanie.
Thank you so much, Stacey. Does anybody have any questions for Stacey about will requirements? You can just pop them in the chat. No? All right. Well, we're going to talk with Aachal a little bit about her experience with will requirements and moving from the US to Australia for, our program. So Aachal, when did you start working on your will requirements?
I want to say I started working in like end of September, October-ish, mostly with just the doctor's appointment stuff, but blue card and all the NDIS stuff when I moved to Australia in January.
How did you find completing the will requirements?
It's not super bad if you start working on it early. And also when you come to Australia, they give you like a lot of time to finish it. Like it's not due for like a couple months after you get here. So it's not that bad. I will say I had to take the Hep vaccine like 3 times before the antibodies were detectable. So that does take a while, but other than that, it was all pretty smooth sailing.
Thank you so much. Did you find the In Place and My UQ easy to navigate?
I think any new website takes a minute to get used to, but once you're like on there a few times and everyone is doing it at the same time and everyone is new to it, you kind of figure it out together.
And then did you feel supported, or if you had any questions, like was staff available to assist you? Did you have any questions like during this process, or was it all laid out very straightforward for you?
I think so. I personally didn't have any issues, but I know some people ran into issues with the FBI check and stuff, and I think people were pretty responsive, and some people didn't end up getting theirs done till way later because of random technical difficulties, but it ended up working out.
What was your easiest will requirement to complete and your most challenging?
I think easiest was probably like the iLearn modules because it's just a matter of doing them. And the hardest for me was the vaccinations just because of getting appointments and stuff and having to do it before I left, but it was okay.
And do you have any comments about your transition to Australia and will requirements?
Um, I would say it sounds a lot scarier than it actually is if you take it step by step. And I think there's a lot of like strength in being with a lot of Ochners who are also coming for the first time, and it's new and scary for everyone. It's just like lean on your peers, and then the second years above you will also be very helpful in helping you get through it.
That's so true. I was talking with a student earlier today, and first years have already started helping our incoming students. I know second years definitely help our first years, thirds help our second. Like we're so collaborative that way. So I think that's a really good thing to focus on and point out. So thank you so much. All right, this is a different kind of question since no one else wants to put questions into the chat. What are you most proud of as a UQ-Ochsner student?
I think that it's really cool that there's so many different kinds of students at UQ, especially coming from America. I've like gotten to meet people from a lot of different backgrounds, and there's a lot of opportunity to do really cool stuff in terms of like research or even just volunteering, and there's just so much more opportunity, I think, to do stuff in a different country that you wouldn't maybe not be able to do in the States.
Awesome, thank you so much. Does anybody have any questions for Aachal? Give you a few minutes to type in the chat. Or Stacey. Stacey's been great. So it looks like we don't have any questions in the chat. Oh, wait. Okay. So Helene asked, how did you get involved in research? And I assume that's to you, Aachal.
Yeah. Um, when I got here, I just kind of started emailing professors and doctors who worked at hospitals around here. And we also get taught by a lot of different doctors and seminars and workshops through class. So if you ever find anyone that you are like or interested in their research, it's always worth an email. And it's kind of how I got involved.
Awesome.
Can I just
Thank
add to
you.
that as well? We've also got a research portal, but that sometimes can be limited to different types of students in different year levels. But there are a lot of pre-organized research opportunities that way as well. Don't always have to be as, proactive probably as Aachal.
That's true. The portal
Yeah.
is also
Thank you, Ashley. Angie just asked, what has been your favorite part of the program so far, Aachal?
I think my favorite part has actually been in second year when we get to do our outpatient and collaborative care placements. And I got to go, or I was placed in vascular surgery. So I got to see some really cool surgeries as a part of that. And I think it's like fun to see the patient side of it, especially in first and second year when you're sitting in front of a computer for a majority of the time. So it was nice to get that change.
It's so cool that you were able to see actual surgeries being performed, especially in your second year. That's something like a lot of students don't get until like their third or fourth. So that's very, very cool and unique.
Yeah. And a lot of the doctors here are super sweet and very like welcoming. So if you kind of just ask, they'll let you do a lot more than maybe you would think.
Awesome. All right, are there any more questions in the chat? I know we've only used about a half hour, and if there aren't more questions, then I'm going to give you guys a half hour of your time back. All right. So I'm going to give a half hour of time back to everybody. Thank you guys so much for joining. Next month, we will be having a webinar, and it's going to be a day in the life. It'll be focusing on a first moving to second year student and a third year moving to fourth year student, as well as Dr. Joseph, who we've hosted before, talking about teaching med students, as well as his admissions and enrollment duties that he performs. So it's going to be a good focus on the day in the life. So join us for that. All right. If you guys, have anything else to add, if not, I'm going to give the time back, and thank you guys so much.